Good morning or good afternoon, depending on where you're at. I'm going to get us started while people are joining. My name is Emmy Betz, and I'm excited to be co-hosting this webinar with Megan Ranney from AFFIRM. I'm an emergency physician and a researcher at the University of Colorado Anschutz Medical Campus, where I direct the Firearm Injury Prevention Initiative. The initiative is a venture through the Department of Emergency Medicine and the Injury and Violence Prevention Center of the Colorado School of Public Health. We seek to coordinate, synergize, and stimulate collaborative approaches to firearm injury prevention. And today's event is the second in a series intended to be a how-to for how we can better talk and work with each other. The initiative has a few core values that I'd like to share because I think they really frame our ground rules for today. The first is a recognition of a common goal of health and security. The second is respect for diversity and consideration of a range of views. And the third is engagement of affected communities and those with lived experience. So we come here today to listen to and learn from each other, and with the recognition that words matter. We're excited to have a diverse audience joining us today that includes public health professionals, clinicians, firearm instructors, and many others. And we're hoping today's session will prove useful to you no matter your context. Thank you all for submitting questions and ideas when you registered. So we went through all of the questions and ideas, and we won't be able to get to them all. We've decided today we're going to focus on 3 topics based on questions submitted. After we do some introductions, we're going to be talking about youth and how we engage with kids and parents. We're going to be talking about firearm storage, and we'll be talking about what healthcare providers specifically should be thinking about or how they can talk about these issues. Each of these could be a session on their own. So I know we won't be able to cover everything, but we're hoping that we can have an interesting conversation that leaves you with some new ideas. I also want to acknowledge some of the key issues we are not going to get to today, but we hopefully will in future sessions. That includes the very important issues related to race and policing and firearm ownership. We are also not going to get to things around current evidence for various interventions. That's not the goal of today. And we're not really going to be talking about legislation, also a whole topic in and of itself. So before we get started, please put any questions into the Q&A box. We will be watching that and we'll try to get to them. The session is being recorded and will be available later. And I want to thank the speakers, the panelists for coming. I want to acknowledge that all of the opinions expressed today are those of the speakers without any specific endorsement by any organizations. But let's jump into it. So we're going to start with some introductions. We're going to ask each person to introduce themselves and say something that they've learned from these kinds of conversations we're having, especially from last session. So I've already introduced myself, but I will start with what I learned. I think for me, a lot of the work I do is in suicide prevention. So I really loved hearing from Fatimah some of the messaging guidelines around how we talk about patients at risk of interpersonal violence or patients who've been injured, and how important it is that we are careful not to assign or assume any kind of blame or criminal activity. And now I will turn it over to Megan.
Thank you, Dr. Betz. So I'm Megan Ranney. I am an emergency physician at Brown University, and I'm also the Chief Research Officer and co-founder for AFFIRM Research, which is a nonprofit dedicated to nonpartisan public health approaches to firearm injury prevention. Also co-sponsoring this today with Dr. Betz. My work, as opposed to Emmy's, is traditionally focused really on youth violence and around the discussion of firearm injury. A lot of those of you that know me know that a lot of kind of the stuff that I do is around kind of how do we reframe how we consider firearm injury to happen and therefore how we prevent it. And I think that one of my biggest takeaways from our last session was really just how far we have to go. I feel like I spend so much of my life steeped in this attempt to cross boundaries and bring groups together and spend so much time trying to think carefully about words. And yet found myself using words I wished I hadn't and learned so much from the other participants and learned so much from all of you in your questions. And so the biggest thing that I'm hoping to get out of today is to move this discussion forwards a little more, to give all of us, whether we're researchers or practitioners or leaders in our own areas, to give all of us a few more tools in our tool chest to help confront this American epidemic. So with that, I think I'll turn it over next to Fatimah.
Wonderful. Good afternoon and good morning to everyone. My name is Fatimah Loren Dreier, Executive Director at the Health Alliance for Violence Intervention. We are a national organization that helps stand up hospital-based violence intervention programs in the country and progressively around the world. It's been such an honor to join this panel, this discussion. We rarely have opportunities to talk across different ways we touch these issues. And for me, I took from the last discussion, first of all, it was such a pleasure to learn about suicide. I think there's a lot more that can be done to explore suicide, and we work on those who are violently injured and at risk for homicide. So I think there's just a lot more we can be learning, and particularly at the intersection of communities of color where we're seeing elevated rates of suicide. So I'm really looking forward to exploring that not only here, but in the future.
Next, I'll call on Rob.
Thank you. Rob Pincus. I'm the Executive Vice President of Second Amendment Organization, and I'm also someone who's worked in the firearms industry for about 25 years, former law enforcement, and primarily I'm a firearms educator. So I educate people in the defensive use of firearms, but also more and more in just the responsible ownership and use. What I've really learned, I think, especially going back to the last session, I've learned the most, I think, in this conversation about that interpersonal violence, the terminology there, who it's affecting. A lot of the work that Fatimah is doing and the insight that's being shared there helps have conversations with people who also we see as being very much in need of education around firearms responsibility. And there's a lot of terminology around that from our gun side that we see that, we know we have to be careful, about that legal issue. And the legal issue is completely different from the responsibility issue. And I think that's really important to keep bringing up. So I appreciate that.
Thank you. And last, but certainly not least, Dr. Harkavy-Friedman.
Hi, I'm so glad you're all here today, and I'm glad to be on the panel. And I'm Jill Harkavy-Friedman. I'm the Vice President of Research at the American Foundation for Suicide Prevention. So one of the great things about going last is that everybody's taken all your ideas. So thank you all for saying what I was going to say, but I'm going to reiterate and maybe summarize and hopefully add something. So first of all, I think that I've learned a lot about some of the terminology that I didn't know anything about in each of the spaces that we're talking about. And also the approach to people that varies, that we have to have a broader and more diverse understanding of how people experience our words. And Fatimah, I really learned a lot from what you were saying about the assumptions that people make. I just think a person comes in and you take care of them, but actually that's not how it goes. And people make all kinds of assumptions that affect the care that they get. So the other thing is that, thank you for mentioning it, how much more work we have to do in the area of suicide prevention to educate people about suicide. Grateful because 35 years ago when I got in this field, there was no conversation. So I think we've come a long way, but we still have a lot of work to do, and people are really receptive about it. And it's changed because we know we have some things now that we can do to help prevent suicide. So thank you all for including me.
Thank you, Jill. And I think that honestly, your journey over the last couple of decades with the discussions around suicide prevention in many ways mirrors the journey that we're hoping to certainly not start in this series of events, but push a little further. And I hope that 15 or 20 years from now, we can look back and say that that the field of firearm injury prevention has moved forward in similar ways, where we incorporate the voices of survivors and affected communities and do so in ways that both are respectful, that create chances for healing and that create chances for true prevention. So I really appreciate that comment and all three of your insights and reflections. So with that, I'm going to dive right into our topics. As Dr. Betz outlined, we're really, unfortunately, so to all of the people that are attending, thank you for your thoughtful comments and questions. As Dr. Betz mentioned, if you're coming on just a little bit late, we're not going to be able to, unfortunately, get to every question that was submitted, but we may be able to move forwards to other events in the future. So I'm going to do my best with Rob, Fatimah, and Jill to touch on some of the big themes. So the first one we're going to talk about is really relationships and language around talking to youth and to parents about firearm injury and firearm injury prevention. And so I'm going to start by asking a question of Rob. Rob, something that we touched on a little bit last time, but that we saw a lot in people's questions afterwards, was about how to talk to gun-owning parents about firearm safety around kids. And I'd love your thoughts on how you approach that and how you would counsel other folks to have those discussions in a way that's both going to be respectful, but also most likely to lead to safety behaviors.
Yeah, it's an incredibly important area because of the emotion around it inside the gun community. When we see a tragic, death or any serious injury involving children at the end of a string of negligence or irresponsibility that comes from the parent or another firearms owner in the vicinity of kids, it's just, to me, it's one of the easiest places to make an impact. And it should be noted that an impact has been made. The numbers of child-involved accidental and negligence-related injuries has gone down dramatically because of firearms education, but one is too many, as we always say, right? So I have a 25-year-old daughter who was raised around guns and shooting all her life. I have a 3.5-year-old granddaughter that is her daughter. And I also have a 5.5-year-old that's maybe likely to jump in here any minute and try to say hi. She wanted to go shoot her MP5 later today because we're out at my office at the range in Florida. So having had a lot of kids around guns and along the way, some step kids, and certainly have influence the training community in terms of our family firearm safety program seminars that we run, I think it's really incredibly important, first and foremost, to have the conversation. And not only to have the conversation amongst family members, but have the conversation amongst gun owners. So one of the things that happened, I don't know, probably 10, 15 years ago from the gun control side was this idea of was called the Ask campaign. And the Ask campaign was presented as a parent letting their parent go over to the home of another child, asking the parents if there were guns in the home. And then maybe the follow-up questions of how they were stored, responsibility, do the kids have access, all those kinds of things. I understand the emotional response to a lot of people in the gun community, obviously, when they say, oh, that's coming from the gun control side and it's none of their business if I have guns. But honestly, this is a question we need to be asking as well. We should be asking it with the hope of encouraging that there is responsible storage going on. So the first thing I say to everybody in the gun community is stop being defensive about how you store guns or that you have guns. Because again, if you're a proud American gun owner and you're responsible, you should be wanting to talk about this and wanting to advocate for responsible practices around children. So if a healthcare professional asks, if a neighbor asks, if a teacher asks, I don't care who's asking, you should immediately respond, well, why, yes, I do have firearms, and yes, I am responsible. And if you can't say that responsibility part, honestly, let's have a real conversation about it. So inside the gun community, more and more, I think of gunownerscare.org, which is put together by the National Shooting Sports Foundation, more and more Project Child Safe, which is a program that they've been running for well over a decade now, maybe 2 decades, all to encourage responsibility around storage. Staging is another thing that we talk about when someone wants quick access to a gun for defensive use, but also wants to prevent unauthorized access. It's just an incredibly important conversation. And identifying the people who shouldn't have access to guns really is the challenge, I think, for a lot of gun owners, because they see their kids being responsible around guns with them under their supervision, and everybody wants to give their kids the benefit of the doubt. That they're going to be responsible, they're going to behave, they're going to follow the rules, even when they're not watching them. And the reality is, we just know that's not how kids work, certainly not how teenagers work. And I think that we need to just redouble our efforts to take the precautions for the worst case scenario with kids, because obviously none of these families involved in the kid gets the gun out of the purse or the kid gets the gun after school when the parents are away ever have thought that could happen to them. But all we need to do is a quick Google search and we find out it does happen inside of our community. So it's something that I take very seriously. The Rights and Responsibilities Manifesto that I have up behind me is one of the places that we touch on this. What we are sensitive to, that emotional pushback of someone having a gun control or a rights restrictive agenda, is where that crux comes in for healthcare professionals. You know, that's why the terminology guide is so important. The idea of how you talk about this, what you say, and understand the difference between empowering responsible behaviors and talking about restrictions or what someone must do or maybe should do from outside of the gun community. There is plenty of information from inside the gun community where you can reference people to, well, here's a best practice, here's a guide. Yeah, I realize you want a gun to protect yourself in the case of violence or threat of violence in your home. Here's how you do that, from pro-gun websites, from Personal Defense Network, from National Shooting Sports Foundations, as opposed to, you know, Every Town for Gun Safety, where not everybody in the gun community takes the safety part seriously.
Thank you, Rob, for those thoughts. You brought up teenagers in particular, and so I want to shift over to Jill now. And when we talk about teens and particularly the risk of suicide, and that we know that suicide has been a growing concern in youth. I think the COVID pandemic and isolation certainly are raising those concerns even more. Jill, can you comment on sort of how to talk to youth and parents about suicide risk generally? What are some of the basics there?
Okay, so I think the first thing to realize is we all have mental health. And right now, all of us have a challenge to our mental health. And a natural response to this kind of time is to feel more stressed, is to have more anxiety, have more depression. So if you're seeing some of that in your kids, it doesn't mean that they're at risk, but it's a natural response. And even that means that we just need to get to know what's going on with our family members, with our kids. So the first thing that's important is to educate yourself about risk factors and warning signs, so you actually know what to look for. Because suicide is complex. It's not one single thing that's going to cause some. I don't know how I got that, but COVID doesn't cause suicide, right? We're all experiencing suicide. Most of us will not even think about suicide. So what happens is there are certain risk factors that people might have, like having a mental health condition, though most people with mental health conditions do not die by suicide. Having a family history of mental illness or suicide. Having experienced abuse or trauma during your childhood, substance use, having had a head injury. Because remember, suicide is related to brain function. And when the brain gets taxed or traumatized, that changes thinking and ability to control your behavior. Is there pain or a medical condition? So what are the social skills that someone has to manage suicide and suicidal thoughts? So all those things are risk factors. Then there are the current things. Is somebody intoxicated? Are they in the middle of a mental health condition? Are they experiencing stressors, which right now we're all experiencing stressors, and how they're handling that? And then there are the protective factors, like feeling connected, having sometimes faith and spirituality, access to mental health care, and the willingness to use mental health care. And then finally, there's access to lethal means, right? So we have these risk factors, and then there are the more immediate risk factors. But you know, truth is, you can only die by suicide if you have access to lethal means. And that's what's relevant to this conversation, because many people, parents, kids, physicians, don't make the connection that for someone who's in distress, having a gun in the house can be deadly. And so we need to know those risk factors and warning signs so we can look at our kids, know them, and then ask them how they're doing. But also, if we see something, to have that conversation with our kids. Hey, you know, you haven't been sleeping. I haven't seen you talking to your friends lately. What's going on? How are you feeling? You don't start with, are you thinking of killing yourself, right? That's not really a conversation. But you start with what you see, and you let people know, you let your kid know that you care about them and that you're there for them. Even if in your mind you're terrified they're going to say yes, which usually even clinicians, we're all terrified because we don't want to lose somebody, and we don't want somebody to feel so terrible that they want to take their life. So we want to have a conversation with them. So I noticed you're not sleeping, what's going on? And they say, nothing much. And really, because you're not acting like your regular self. And give them room to answer. But if they don't, give them space to come back. Well, I'm here for you and I care about you and you really matter to me. So if something's going on, sometimes when people aren't feeling well, they think about killing themselves or taking their lives. And I would be explicit. Suicide is a lot of different interpretations. Are you feeling that way? Oh, Mom, don't be ridiculous. Okay. But if you are, I'm here for you. And if I'm not the one you want to talk to, then you can talk to Aunt Susie because you know she loves you too. So you broaden the scope that you're not the only person that the child can talk to. And the other thing to remember is that when you're in that suicidal state, we often hear that people say things like, well, I know my family loves me and I love my family, but they'll be better off without me. Because that's the logic of a person who's thinking about suicide. So they may even be talking to you about giving away stuff, or things will be better for you later, or I won't be around, all those subtle things that sometimes start even a year or two before. So early intervention makes a difference. So that's illogical. I love you, you love me, but you'll be better off without me, so I'm going to kill myself, right? So it makes sense to them though. So part of it is opening up the thinking. So when we talk to kids, we don't want to be judgmental. Don't be judgmental. Don't try and fix it. I'm saying that because that's exactly the opposite of how you should talk like that. You don't have to and can't necessarily fix it, but you can listen and if need be, help your child to get help and be positive about help. Help them understand that getting help is part of being independent and taking care of yourself. In our lives, we all have different ways that we take care of ourselves by enlisting other people. And taking care of your physical and mental health is a way to do that. The other is help them to get on a schedule and to take care of their basics: eating, hydrating, sleeping, exercise, hygiene, interacting with their peers. So those are all things that you can also address to help open up their thinking. But most of all, compassion, respect, patience, and persistence. My 4 life leading words are really key here. Respect your child and have a real conversation with them as a whole person, and then just listen to them.
Thanks, Jill.
Thank you, Jill. That's beautiful. And you have potentially saved some lives today by sharing that. I think hopefully we can all take that with us as ways to interact with our loved ones and those around us.
Yeah, I just want to add that on our website, affsp.org, we have guides to help you have that conversation. There are guides for parents, there are guides for just anyone. And we also have the Seize the Awkward campaign with the JED Foundation and the Ad Council, which is really fun. And even my 80-year-old mother loved it. So it's not really just for kids. So check those things out. You don't have to do it on your own. There's lots of support.
Thank you. So I'm going to stick on the intervention and youth kind of theme here. And my next question is for Fatimah. It's about youth who are involved with violence against others. They've been either victims or perpetrators. And as we know, those two often overlap. What do we know about best ways to intervene? How do you have those conversations with youth or with their caregivers?
Thank you for that question. Again, really appreciate the discussion so far. I'm actually going to start with a story because I come from communities in which there were high rates of gun violence. I'm originally from Plainfield, New Jersey. And my father was in and out of prison most of my life. And I remember my first time as a child, around 4 years old, witnessing my father come back from street brawls, engaged in violence, being arrested by the police in front of me, and believing that I was next, right? I was next to be harmed, next to be taken away. That in communities that are disproportionately impacted by homicide, the exposure to trauma, particularly for young people, is astronomical, and that those exposures are so normalized within communities and in the institutions that support them, right? So schools and other sorts of social services, that it becomes quite challenging to think about how you protect or support young people who have such exposure. We know from adverse childhood experiences from a number of studies that these early exposures have lifelong impact, but they are not they're not fixed, right? I think that there are tremendous opportunities. So I start there to say that by the time we see young people engaged in activity of harming another person, another peer, there's a very high likelihood that there's been a lifetime of exposure to trauma, and we're learning more about it. We're learning more about how it changes a child's brain, but that context is incredibly important. Another component or dimension of this is structural racism and the way in which people experience, particularly in communities of color, peer groups as a protective, as a way of managing, processing what they see as being at the bottom of the totem pole, and being in the social strata, I should say, being at the bottom, and that some of the behaviors are part of trying to create a sense of belonging. So in our last session, I talked about the ways in which the term gang evokes a tremendous amount of negativity, right? And those who hear it, because it's so associated with the violence that gangs are known to engage with one another. We sometimes use the term group because it conjures, I want to be a part of a group. I'm sure we all want to be a part of a group, and that actually groups of young people actually provide a sense of belonging and provide a sense of protection or a way to connect that's actually quite meaningful for young people. So understanding and listening to young people and what they're navigating, what they've seen in our programs, when a young person has been a victim of a firearm and are in the hospital, they're often not just talking about the acute stress of that injury, but a lifetime of trauma that has not been discussed, disclosed. It all kind of comes up. And so I think that there are opportunities further up to really think about social emotional learning in schools, ways of talking to parents about what their children are seeing, because often parents are themselves overwhelmed, may have experiences or are dealing with substance use issues, or quite frankly, could be really confused at what their child is navigating, because it is something that might be unique to young people and their networks. And so we often hear parents say, I don't understand. They've left the house, they've gone and they're connecting with these groups. I want them to stay home, or I want them to, and it's not a conversation. That I think is really hard. There are parents who care so much about their children. They're concerned about violence within their neighborhoods, but feel really lost in terms of what to do. And so these are conversations that I think can be quite overwhelming, but there are opportunities. I think gaining larger public awareness about the impact of trauma is really, really important, to think about non-disclosure based ways of educating, right? We don't want to wait for events to happen. We want there to be widespread understanding of the impact of trauma, and to have conversations about that with young people directly. I think that's incredibly important. I think, last thing I'll say is I believe in the power of leveraging groups and belonging to be part of the medicine, part of the healing. And so I've been encouraged and inspired by youth-led groups and group therapy, group processes in which young people get to talk to one another about what they're seeing and what they experience. I think those sorts of programs are powerful and in many different settings. For our hospital-based violence intervention programs that are in a pediatric setting, they're sometimes managed by staff of those programs, but we certainly see those in schools. And I think those are wonderful practices. And again, some of those social emotional learning components that support young people in their mindfulness, support them in articulating things that they've seen, their emotions that they're feeling, and how to manage conflict, inner conflict and conflict with others, I think are especially powerful.
Oh, thank you all so much. I mean, we could talk about this all day in and of itself, and I really appreciate your thoughtful answers. And I think it's really touching on so many different domains that are sometimes overlapping and sometimes distinct. I'm going to switch gears a little bit now to move on to our second kind of area for discussion, which is storage. And I think in some ways, maybe this can be a little more concrete in terms of the language we use. We got a lot of really good follow-up questions related to messaging around storage and what words to use. So the first question for Rob, I think the big question we got from especially healthcare providers and folks who do, suicide prevention and unintentional injury prevention work, a lot of the messaging out there right now is around secure storage or safe storage. And then I think used the word staging, which is not something we hear as much. So my first question, when we say as doctors or as public health folks are talking to people, can we say secure storage, meaning not accessible to unauthorized persons?
I would strongly suggest getting right to the meaning, because the issue, the subjective meaning of what is safe and what is secure is one of the areas that causes a lot of, I think, emotional angst and maybe some of the back and forth. Again, let's go back to what I said earlier. I don't think the parents believe that they are being unsafe or believe that the guns are unsecure. In fact, people can find videos of me explaining that a hidden gun is preventing, if you hide a gun, it is preventing unauthorized access to a certain level. However, if you have an unsupervised person in the vicinity of the hidden gun, you don't have much security. And that's really, that nuance and that subjectivity is really important. Once you're living with guns every day, I have guns on the wall back here that actually live in a safe when I'm not doing some kind of a live broadcast or doing some kind of an educational piece here. Now that gun in front of this flag, that's a replica. That's not a real gun. People watching this wouldn't know that, right? And if someone came into this room and saw that up on the wall, they might think, oh, wow, he's got a 5-year-old that hangs out in the classroom and the classroom isn't always locked and there's a gun that's up here all the time. Well, again, that's a replica. And some of these things are really hard and nuanced, right? People will say, well, you have a child in the house. Shouldn't you prevent her from wanting to touch any gun? Well, the problem is if we create that fear and that curiosity and that forbidden fruit kind of thing, maybe the minute I turn my back or I get distracted or anything else happens, now there's that curiosity that leads to negligence. So it really comes down not to, is it secure? Is it safe? Is it preventing unauthorized access? That's the real question. And I think putting that impetus onto the parents as a healthcare professional, what steps do you take to prevent unauthorized access to your firearms is a much, I think, more constructive question. The problem is the healthcare professional qualified or prepared to put a value judgment on the response? I don't know that it matters. I think asking the parent that question forces them to confront a couple of things. Are they proactive? Are they taking steps? Or are they just they have guns in the house and they haven't really thought about it? That's a really good place to start, just making that process happen. The other one is who is unauthorized access? Who are these people? So again, as I said earlier, the categories of unauthorized access: people who aren't educated in the proper use of firearms, people who aren't physically capable or mentally capable of understanding the ramifications of misuse, people who are in any kind of a state of mind where they aren't executing good judgment, they don't have anger or rage control, they may, we think of dementia, someone who isn't processing information accurately and properly to reach the right conclusions about whether it's appropriate to use a gun or whether they need a gun for defense. And then, of course, the malicious, the criminal, right? So if you have a gun hanging on a wall that's unsecured, a live gun, not a replica, and it could be used to hurt somebody, and you have, your windows shades open and your home is unoccupied and unsecure and doesn't have an alarm and doesn't have motion lights and doesn't have, reinforced locks or cameras or anything to prevent someone from breaking the glass and taking the gun, well, that's probably the most obvious way to engage someone in the idea of a secure firearm. And what is a secure firearm? A firearm in a safe is secure, but that also then doesn't allow you the access to the gun for personal defense. So, one of the things we talk about is a quick access safe. So it's a quick access safe, which is very inexpensive. There's no RFID, there's no biometric, there's nothing here. There's a mechanical set of buttons on the side that if I push them correctly, spin the lock, this now opens up and I have access to the gun very quickly and efficiently. At the same time, I could put a loaded gun in this box with the 5.5, 6-year-old in the house, and we don't have to worry about the negligence. We don't have to worry about the unintended consequences. We don't have to worry about that injury that happens from trying to access the gun. 15-year-old could break into that safe, right? 12-year-old might be able to break into that lockbox. And that's where the issue of I often tell parents, if you're worried about the kids breaking into the safe, that's a parenting issue that goes far beyond guns in the house, right? Because now we talk about the means to the lengths to which someone will go to violate, common courtesy with their parents, respect for the parents, respect for private property, destruction of property, all of these other issues. So this is where we start talking about voluntarily limiting the access of firearms even in the home, right? If you do have, and this now ties back into the mental health aspect, right? If you have to take away, your grandfather's or your father's car keys, should they really have a loaded shotgun behind the door, right? Well, are we taking away their right to self-defense? No, but we're limiting their access to guns because we're concerned about their judgment or their physical capability to control the actual tool. These are complex questions, but I think they come back to not, are you safe with your guns? Because the natural emotional response of any firearm owner is going to be, yes, of course I am. Why would you how dare you ask me that? But what steps are you taking to prevent unauthorized access is probably a better place to start.
Okay, so I'm just going to echo back what I think so for you, you're suggesting it's more about the access, the sort of safe storage is somehow a vague definition of what safe means. And then staging is not necessarily the first term that people would use, because that's more about how you might store a gun so that you could have rapid access for personal defense, for example. But so for the clinician kind of realm, thinking about it more from a point of who has access, preventing access, that kind of thing is that what you're, yeah.
Absolutely. And I would suggest that a good kind of question to get you in the right direction is, well, do you have a concealed carry permit, or do you own guns for defense? Right. And then the answer being yes leads you immediately to, you wouldn't say something like, one of the things we'll see sometimes from outside the gun community is, well, do you keep your ammo and guns stored separately? Well, if I have a gun staged for defense, obviously I'm not doing that, right? I can have, a gun that's, disassembled. I can keep this part in one room and this part in a safe over here and the ammo in a third box. And that's fine for my hunting rifle that I'm going to, get out once a year and go out of state on a trip. And I know when I need it, I have a lot of warning, right? I had to get the license. It's a certain day. It's a certain kind of animal. I took a trip to go hunt. But on the other hand, the gun that's staged for defense needs to be loaded, or it needs to be stored in a quick access box with the ammo so it can be loaded quickly. So it really, really dramatically changes the physical action of appropriate acts and steps, whether we're calling it staging or storage, for the context of intended use. So if a clinician, a healthcare professional was asking that question, do you own guns for defense? It's not being nosy. It just informs what the next question might be, because it would be completely inappropriate to store a gun disassembled or separate from its ammo if that was the intended use.
Thank you. This is tough. This is why we want to do this. Yeah, Megan.
And I saw someone kind of put in the chat, kind of with the caveat that we do, right? So, and I think, Rob, the important distinction that you're making here is that if it is stored in a way that it is inaccessible, right? That maintains the safety aspect. And that there is this kind of, this definition of secure storage, which is put out by both NSSF and AAP, which is about being stored locked and unloaded. But your point being that you have to allow this kind of larger spectrum as long as you make sure that it's stored in a way that is locked and inaccessible to unintended users, right? And so kind of you're talking about a way, and I'm going to put one more kind of editorial comment, which is that from my perspective, this is this harm reduction concept, right? Which we talk about all the time in medicine, which is that our goal is to move someone from the least safe thing. We are not necessarily, right? Just like the most safe thing would be to not have any cars in the universe, then no one would ever get in a car crash. The reality is that's not the world that we live in. And so instead of saying, get rid of your car so you don't have a car crash, we say, wear a seatbelt, make sure you have a car with anti-lock brakes. If you know, that we mandate anti-lock brakes now, we have car seats, we have, you know, et cetera, et cetera, et cetera. And so just to kind of, perfect.
Yeah, that's the key is understanding. And again, National Shooting Sports Foundation isn't personal defense network, right? So there is a difference. If you're talking about a gun that's merely owned for sport, separate storage for the gun and the ammo absolutely makes sense. Disassemble it, you know, whatever you want to do. Any of those steps make sense in the context of the shooting sports, not so much in the context of defense. And this would be, there's a nuance to this, right? And inside the gun community, when, for example, the NRA says, I think their current guidance is still keep all guns unloaded until you're preparing them for use or until you intend to use them. Well, again, the gun that's staged in that quick access safe, to me, is being used. It's fulfilling its purpose of being ready for me to access for the defensive use for me, my daughter, family, anybody I care about. So it's in use. And sometimes we see that as a gotcha. Oh, but wait, if your gun has ammo in it and you're not standing on a gun range, pulling the trigger and shooting, you're violating the NRA's guidance. Well, contextually, I'm not, but that's a nuance.
Thank you. I'm going to move on, and I think we could talk. I have like 1,000 other comments and questions, but I'm actually going to move on back to kind of a different question, which is how might, and this is to Fatimah, how might these discussions or conversations be different in communities where youth or adults are frequently exposed to violence? And I know, like, I've had conversations with Scott Charles in Philadelphia, right, where we're having a huge increased number of both unintentional shootings, but also kids hurting or killing themselves with unsecured firearms in communities where there is a high rate of community violence. So how do you talk about secure storage at home while acknowledging these real dangers that people face? And again, the same question that Rob is talking about, which is that people might own a gun for protection.
I think this is a really important discussion, and we need to do a lot more here. You know, just full stop. There are a couple of pieces to this. I think first is acknowledging that there are firearm owners in communities, and this question about, there's like kind of one axis that's looking at the legality, right? Are these firearms legally owned or not? And if we stay stuck and fixated on that, then we miss the opportunity to have a whole another constellation of discussions about the fact of firearm ownership and what to do. And I think that is when the framing, Megan, that you offered of harm reduction is critical here. So because if we look purely at the dimension of legality and make moral judgments or judgments writ large, we do miss these opportunities. So that I think is an important distinction to begin with. I think there's also because of this dimension, right? We also have to kind of understand that disclosure is a question. People may or may not disclose ownership, right? Which is, it's slightly different than the kind of proud owner and we're out and we're proud, or disclosure is kind of confined to people within a particular network. So, when I say this, because having a physician ask a question about ownership of a firearm in a medical setting, you may not get the truth, right? I mean, just to be really frank. So I think that if we are to educate, a part of the conversation will be not to rely on disclosure for education. That I think there needs to be a more discussion generally about safe storage. That's number one. The second is, in our work, we look a lot at, we look very closely at credibility and credibility of those who are talking about the very issue. And I think this is something, Rob, that our work, and Jill, your work, that we have in common. It's that that for any particular kind of target or audience for the particular education, that we have to pay attention to who those listen to, who the people we care about, that we want to impact, who do they listen to, and how do we empower those that they listen to relay those messages with the language, with the phrasing, with the context that matters. And we have found that our community health workers, our violence intervention specialists who are hired and are in communities who are talking about violence and its impact, and trauma and its impact, have our workforce that we can leverage to talk about safe storage, which I think is really exciting. And while I see some areas in which that's happening, I think there's more. And I think it'll be these credible messengers that will articulate and let us know the most effective way of delivering those messages. We really have to listen to that workforce who are much closer to those who are firearm owners in communities of color, and learn from them how they're able to have these conversations. And you're absolutely right. It is the unintentional shootings. It is young people, children who gain access to firearms in the home that have really rocked communities of color, who often think about violence, homicide, intentional interpersonal harm as the primary way in which harm happens. And that's not necessarily the case. So it's these events that really have communities recognize there are other ways in which people are harmed, and that there are other solutions that need to be kind of embedded.
Thank you so much. And I love this thread on sort of credible messengers, which is exactly, I think, part of what we were trying to do here, is to all educate ourselves about how we could try to be better stewards of messaging. And I want to turn now to Jill. We've been talking about sort of storage and access, but now also moving into healthcare and messaging. And I was wondering if you could comment a bit on the work AFSP has been doing with the National Shooting Sports Foundation, and sort of how that in developing messaging specifically for the firearms community. And perhaps you might touch on sort of recommendations for healthcare providers when an adult is at risk of suicide, and what's recommended there in terms of the specific messaging about firearm access. Oh, and you're muted.
Again, in our partnership with NSSF, we're all aimed towards preventing suicide. That's the goal of our partnership. And so to that end, it's all about educating people, first of all, about the association between having a gun in your house with somebody who is at risk for suicide. So it's not really about having a gun in your house, but we need to remember, for instance, that 70% of kids who die by suicide with a gun, it's not their gun, it's their parents' gun. So having a gun in the house has nothing to do with the gun owner. It has nothing to do with anything special about the gun, but it's that having access to lethal means is what increases the risk for suicide when there's somebody who's at risk. So it comes back to, our goal is to educate people about what are the warning signs that somebody might be at risk, And those are about behavior, what they say, and how they feel. And so we're educating people that when people are acting recklessly, or they're drinking more than usual, or they're in the midst of a mental health condition, or they're telling you that, as I said before, well, things will be better down the road. You won't have to worry about me anymore. Or I hate this world, this life, or one of our people with lived experience just told his parents, you've been really good parents. And that was how, I just want to say, when my kids said that to me, I had a moment of panic, but then I realized that they were just trying to be nice. So that's where context comes in. Like, it's all about knowing the person you're worried about, trusting your gut. So then also, they don't necessarily, well, they might be talking about taking their life. They might also just be talking about life is not worth living. Things will be better when I'm gone. And their moods can vary from depression to rage, anger, people, agitation, which is really different from rage, right? Rage is anger, agitation is more not being able to sit still, which turns out to be a very uncomfortable feeling. And so what we're trying to educate people to look for those warning signs, because suicide often happens because the person is in pain, not because what they want to die. And this is where the issue comes in about lethal means, which is if they don't have access to lethal means, their brain is functioning in a way that they don't see options. So if you don't give them the most lethal method, then they have time to de-escalate, because often it's a crisis. There's also time for intervention. And if they are going to do something, then they're likely to choose something that's less lethal. And we know that about 95% of people who make a suicide attempt actually don't die by suicide. So if we can get them through that crisis and help them to get some help, there's a good chance they're going to re-engage in life and things will go on. So with NSSF, our goal is to educate people about risk factors and warning signs and what to do and how to have that conversation if you're worried about someone, and how to make the lethal means, in this case, we're talking about guns, inaccessible. And it's one thing to make it inaccessible to somebody in your house. It's another issue to think about how to make it inaccessible to the gun owner who's in the midst of a mental, of a suicide crisis. And so you might do different things. You might have different conversations. And I just want to say, Emmy, your work with Lock for Life, which is something everybody should check out, which tells you if you can't have that firearm in your house at that moment, here's a place you can put it that's near you. So it's all about how to have those conversations, how to help people get through that suicidal crisis to the other side, and how to stay alive. I mean, that's really what our goal is. We do have, I just want to say, there's lots of information on our website. If you type in Project 2025 AFSP, and that's 2025, .org, you'll see we have brochures that are made by gun owners for gun owners. We have trainings, Talk Saves Live, to train gun owner groups, like, again, Emmy, you've done, right, with the Well-Armed Woman and other groups. It's really about educating people to make that link so that they can act in a way that helps and save the person who is suicidal.
Thank you, Jill. And I want to specifically address a comment that I saw come up in the Q&A asking, are we not abdicating our role as physicians by having this discussion? And I would say absolutely not. And in fact, we are holding our role as physicians and care providers sacred. Our role is not to pass judgment on our patients. Our role is to make them as safe as they possibly can. And whether you're talking about rural gun owners or young Black men who live in inner city Philadelphia who own guns, when you pass judgment on them, you are going to drive them away and you are going to shut down the possibility for these harm reduction conversations, which is what we are having right now. Yes, owning a gun is going to increase your risk of firearm injury or death, just like owning a car is going to increase your risk of car injury or death. We don't tell people not to own cars. There are times when we say you have a history of drunk driving, you are drunk right now, you are cognitively impaired, and we make decisions. But for the majority of Americans, we're not passing judgment, we're providing people with ways to stay safer. And so I really want to emphasize that, and I appreciate the people putting those comments in, because I think it's a really, really important distinction to make here about kind of the purpose of our conversation. And I think that when we take that judgmental approach, an all or nothing, yes or no binary approach to health and harm, that's where all the conversations go off the road. We wouldn't have that kind of conversation about sex, drugs, alcohol, or cars. And it's not appropriate to have it about guns either. So with that, I'm actually going to turn stuff back to Rob. I know that he had wanted to make a reflection comment on some of the stuff that Fatimah had said. And then I know that we've seen a bunch of questions coming up about kind of language and some of the work that you've done around Hold My Gun and Walk the Talk and ways that you do engage firearm owners. And I cannot emphasize this strongly enough, what Rob has said. One of the things that all of us in this group, whatever group of firearm owners we have worked with, have found is that there is a worry about acknowledging the risk of injury, because they interpret that as meaning that therefore guns are going to be kind of banned. And we have to be able to work with folks to acknowledge that there is a risk of injury in order to keep people safer. And so with that kind of said, Rob, I welcome your thoughts, and kind of I know we only have about 5 minutes left, so if you can keep it to just a couple of minutes, and then I'll let Emmy close. Would really welcome your kind of closing thoughts here to tie stuff back with what Fatimah said and around Hold My Guns.
Yeah, incredibly important. The work we do at Walk the Talk America, for example, has received a lot of pushback, and we work at the intersection of mental health issues and firearms ownership. And there are a lot of issues there to address. It's incredibly important to acknowledge the negative outcomes. And that is something that our community has historically not done a great job of, trying to cover it up or overlook it or reflect the fact that there's 400 million guns and only 3 are involved in some whatever problem you're trying to identify in the last year. That's 3 too many to me, and I think to society. Right now, we may never get to 0, but we can influence that. And I really appreciate, Megan, you clarifying this issue of, it's not about don't have a pool in your backyard, because that'll mean no one will ever drown. We're going to have the pool, but let's also put a fence around it, teach our kids to swim, et cetera, et cetera. Fatimah made a couple of comments that I thought were really important. One, I strongly advocate for education in the school system. We have a public school system that talks to people about sex education, drugs education, pollution, like all the negative potential individual and society things that our children could face on a daily basis or may face in the future. Educating them about responsible firearms behaviors and ownership, that makes it universal. You don't have to have that issue of identifying, oh, that's a family that owns firearms, let's get them in a special room and talk to them. Let's educate everybody, because guns are everywhere. And yes, your kid, even though you don't own guns, could end up in that other house or finding one on the street or involved with friends who have guns. And it's incredibly important to talk about it. And again, I appreciate Fatimah emphasizing that legal issue. Legal gun owners is almost like a weird in-speak anymore. It's about responsible gun ownership. And Black Guns Matter does a great job of addressing this issue. Kevin Dixie with Aiming for the Truth does a great job of addressing this issue. I don't care how you got the gun, why you have the gun, but if you have kids in the house, I want you to be responsible with the gun. Incredibly important message. And Jill's message also, which again ties in with the Hold My Guns idea, voluntarily going to another person that you trust and saying, will you responsibly hold my guns during this time of crisis, during this time of emotional stress, while I'm dealing with this mental issue, and whether it's a family member or something else. Maybe it's as simple as changing the code on that quick access safe so only another family member has it while you're dealing with, we talk about going off or on an SSRI, dealing with depression issues. There's a lot of times when these issues are incredibly important. They are the right and responsible thing to do, and it's not about taking away rights.
All right, back to Emmy.
I just I'm so grateful to you all for coming and for the open and honest conversations we're having about these really hard issues that I think we could dig into each for an hour. And I'm sure many audience members are left feeling like they want more on each of these things. I want more. I've got lots of ideas for the next one, and I hope that we may have a follow-up session. For attendees, if you want more, please let us know. Send an email. or if you get to it quick, if you put things in the Q&A, we'll try to think about what our next session could look like. I do firmly believe, as Megan said, this is the way forward as physicians and our very important and sacred responsibility in helping people live healthy lives. And I think we do this by engaging communities, by learning from each other. And I think it's relevant for outside of healthcare as well. So with that, we have 1 minute left. I'm very quickly going to ask if we can very quickly, any take homes from today, anything you've learned. Fatimah, put you on the spot.
Oh boy,
One sentence.
always learn so much. Rob, I continue to learn from you, and just really appreciate. I want to just say that I keep thinking it would be great to have you talk to some of our folks and to have Black Guns Matter just have a discussion. So it also tees up for me work as an organization we can do to build relationships with responsible gun owner groups. So thank you for that.
All right, Jill.
Oh, I'm not on mute. I think my big takeaway is that I learned so much, and I hope other people learn so much from these kinds of conversations, and that it's so important for us to have crosstalk and together have these conversations as openly as possible so that we can keep learning and then we can help save lives.
And a Zoom bomb at the end. Rob, any parting thoughts?
I appreciate the conversation. I think it's so important that we cross the barriers and we open the discussion and the dialogue up and reflect, I mean, just the segment that I'm going to pull out is Megan, sort of rebuking the idea that the right thing to do is say, just get rid of your guns and we'll be fine. Because it's not realistic. It's not, it ignores and disrespects the reasons people think they want to own firearms and that they're inherently right in some ways, just because it does fulfill whatever gap that need, even if it's recreation. The reasons people own firearms are varied and justified and real, and we need to respect them as much as we respect our right to do anything else, and then find the best ways forward. It's that safety third idea. We're going to own the guns. We want to achieve a certain goal. How do we mitigate the risks involved?
Yeah. Awesome. Well, young lady, that is how I think we all feel it's time for lunch when we stick out our tongues. So thank you all. We did just a suggestion to take this on the road and call it Crosstalk for Tough Talk. So thank you, Sherry. I love that. Yeah. To the attendees, please stay tuned. We will schedule some kind of follow-up. And thank you again to everybody for joining. Be safe and be well, and we will see each other soon, hopefully. Bye.
Bye.
Thank
Bye.
you.
Bye.